Hello guys, so today we will start our basic and important concept of clinical medicine. Okay guys, so while you are taking history of your patient, so suppose in gastrointestinal system, we will start from gastrointestinal system first, and we will continue by following that. Okay, so today we are going to learn how we will describe the pain. Okay, pain. Okay, suppose a patient will come to you in your OPD or any emergency ward. Okay, so how you will describe the patient pain? Okay, that I'm going to teach you today. So there are some shortcuts by which you are going to describe the pain of the patient. Okay, so you need to remember this: SOCRATES. This is a mnemonic which we say Socrates. Okay, so CRATES. Okay guys, so according to this Socrates we will define the pain. Okay, so S stands for site by which the patient will describe that on which side the pain is occurring, or on which side the pain is uh, occurring on the patient, we can say like that. Okay, so it can be anywhere. So side we can define as epigastric region. Okay, we can say like right flank, right, there are 9 regions. Okay, so in any regions you need to define, the patient will define that in which side the pain is occurring. Okay, so after seeing that site you will think like which organs are present on that particular area. Okay, and second one, onset. So in onset you will see that the pain is gradual, or the pain is rapidly increasing, or whether the pain is sudden, like instantly that is occurring, or whether the pain is more at the starting, and the pain is less while sleeping, while lying down, like anything we can say like that. Okay, so this is onset. And third, it comes with character means what type of pain is this. Like it's like character, how do we define? Like I will say like it's a goning type of pain. Okay, like a bulging is occurring, like whether the pain is constant. Okay, whether the pain is like pinpoint. Okay, that like something is pushing from inside. Okay, we can ask the patient. Okay, so R stands for radiation. So not like radiation like we studied in chemistry, like gamma radiation, not like that. This radiation means that your pain is radiating to some other place or not. Suppose a patient will come to you, he will say like he is having pain in umbilicus region. So okay, this is my example, umbilicus region. Okay, so afterwards he will say this umbilicus, the pain starts from umbilicus, and soon afterwards it will shift to right iliac fossa. Okay, right iliac fossa. Okay, so this is a radiating type of pain by which we can say that the pain is radiating from one region to another region. Okay, so it can happen in any kind of thing. Okay, so from umbilicus and from umbilicus to right iliac fossa, there is one disease which is known as acute pancreatitis. Okay, sorry, acute appendicitis. Okay, acute appendicitis, we will say in this disease the pain will radiate from epigastric, or it may be present in umbilicus area towards the right iliac fossa. Okay, so same like this in pancreatitis also, like in acute pancreatitis, that pain will start from epigastric region, because the tip of the pancreas ends there. Okay, and it will that pancreatitis pain will travel over towards the left hypochondrium. Okay, so that's the radiation part. And Now let's go to A. So A means associated symptoms. Okay guys, associated symptoms. So we can say like this, that the associated symptom, like whether the pain is occurring with which extra factors. Okay, suppose like the pain, suppose the patient is having umbilicus pain. Okay, we will say that in the near the umbilicus the pain is there, associated with what. Okay, we need to define this here, that the pain is occurring associated with vomiting. Okay, suppose if a patient comes to you here, he might be having peptic ulcers or esophageal varices or any kind of thing. So we can say like that, while patient was experiencing umbilicus pain associated with vomiting, we can say like this. Okay, so this is just a association, like this symptom is occurring due to what condition. Okay, so now let's come to T. T means timing. Okay, not like timing up to how long this is occurring. Okay, timing we need to see like this, whether the pain is more in morning time or in evening time. Okay, you need to see like this. Okay, whether the pain occurs like frequently, like hourly basis. Okay, hourly basis. Okay, while on special times, we can say like on special time while the patient is traveling, while the patient is doing exercise. Okay, so while the patient is doing any kind of movement, we can say, okay, any type of activities, so we can ask the patient like for how long the pain resisted. Okay, not resisted, for how long the patient is having pain. Okay, so in timing we can say like that, whether the pain is in morning or whether the pain is in evening. There are many diseases, like different type of diseases in gastrointestinal system, by which we can define this, that in evening time the pain is more. Okay, and the morning time is pain is something else. Okay, so this is the timing thing. Okay, so E we can say like this, the if stands for exacerbating factors. Exacerbating factors. The exacerbating factor means by doing which type of thing the pain will increase. Okay, suppose a patient comes with epigastric pain. Okay, epigastric pain, you know, right? These are the 9 quadrants, and this is the epigastric region, this is the umbilicus region, and this is the hypogastric region. Okay, and this is a right hypochondrium, this is left hypochondrium, and this is right flank, and this is left flank, and this is right iliac fossa, and this is left iliac fossa. Okay, suppose the patient comes to you and say he is having pain in this epigastric region. Okay, epigastric. So what we can think is, in this part in epigastric, there are some organs, we can say. So okay, some organs are left liver lobe of the liver. Okay, left lobe of the liver. Okay, there might be presence of esophagus. Okay, esophagus. Okay, ending is like sphincter ending. Okay, and third one we can say like just stomach. Okay, it may be present like diaphragm is present. If any abnormality can happen in diaphragm, like bloating, gas may be present, we will say like current sign. Okay, like many things are there what we can think about that. Or patient might be having acidity, hyper acidity reflux. Okay, gastro, we can say like GERD, he's having GERD, like gastro esophageal reflux disease, we can that's a full form. Okay, so this is the exacerbating factor, like by which condition. Suppose the patient is having spicy food, at that time the patient might be having that type of pain. Okay, so in peptic ulcer, while patient is having food, only at that time while the patient is swallowing that bolus, at that time the patient is having pain. Okay, but in duodenal ulcer, see, this is the esophagus and this is the big stomach. Okay guys, So suppose a patient is having peptic ulcers. The peptic ulcers main site is most common site, as you will get the in the exam, is a lesser curvature. This is a lesser curvature and this is a bigger curvature. Okay, this is a lesser. Okay, in this area the patient is having the ulcers. Okay, or it might be present on near the sphincter area. This is the sphincter area, right? Okay, so while patient is swallowing food, suppose the food is there, while the patient is swallowing, the pain will occur in this area. At this area, the stomach esophageal ending, facial sphincter is present in the epigastric region. So we need to differentiate between some factors, okay, by which we can say, like, by which exerting factor the pain is increasing or decreasing. Okay, okay, that's the thing. Okay, and at last but not the least, there is some this S stands for severity. Okay, but before completing this severity, in middle of this RATE, there is one more thing, R. Okay, that's something different, or we can say the R stands for relieving factors. Relieving factors. So we can define this relieving factor as by doing what type of things, or by eating what type of food, or eating or doing any type of changing in posture. While standing the pain is there, or while elevating the pain is there, while bending to your legs the pain is relieving, like uh, by which activity the pain is relieved. We need to notice that also, because um, there are some diseases by which we can easily define by relieving factors. Okay, as the patient will tell you everything in history, so you need to note this point also. Okay, so suppose, like, in duodenal ulcer, the thing is, when the patient's stomach is empty. Okay, when the patient didn't had any food. Okay, so what will happen in our gastric mucosa, that SCL will secrete. Okay, that SCL will irritate the duodenal ulcer. Okay, because the stomach is empty and the ulcer is present on duodenum side. Okay, this is a duodenum side, I told you before. Okay, the acid will come and fill this up. Okay, while the patient is having empty stomach, so this will irritate these ulcers. Okay, the duodenal ulcers. Okay, I will put duodenal ulcer. Okay, so while the patient is having food, okay, what will happen, this food will mix with this acid and make it a little bit like neutral, what we can say. Okay, by eating food, this patient will not feel any pain. Okay, so this is a condition by which we can say, after having food, the patient not experiencing any type of pain. Okay, so also we can say, like, the patient is having some medications like antacids. Okay, and after vomiting the patient is feeling relieved. Okay, so these are the relieving factors. Okay, what we can say, food intake. Okay, secondly, what we can say, the patient is taking antacids. Okay, the third one, what we can see, the patient after doing vomiting, the patient is feeling comfortable. Okay, okay. Also we can say that while patient is changing his position. Okay, while the patient is lying down in supine position, while the patient was sleeping, whenever he turns to his right lateral side or the left lateral side, the patient feels relieved. Okay, so we can say the change in sides while sleeping. Okay, we can say like that. And lastly, we need to discuss S for severity. Okay, guys, so on severity, you will ask the patient that your pain is like, from 1 to 10 scale, how the patient will define the pain. Okay, suppose the patient will say that that the pain was very severe, like he was not been able to lift himself from the bed. Okay, so we will define the pain as number 10. Okay, suppose the patient will say that the pain is not that much, but still he wasn't comfortable, we will define that pain like 5. We will give 5 out of 10. Okay. Sometimes the patient will say the pain was there, but he was managing that pain. Okay, so we will say like the pain was like a 7 or maybe 8. Okay, so we need to define that. Okay, so also other than this, we can define the pain like patient is having mild pain. Okay, mild pain is there. Okay, moderate pain is there, or severe pain. Okay, so we need to define this type of pains. Okay, so this is just everything about pain. So let's meet in another video. Okay, thank you guys.